Sis. I'm Dr. Pate. It's nice to see you again.
It's so nice to see you. Thank you for joining us to talk about this week's virus, croup.
Croup is a respiratory illness and it has three characteristics: a barky cough, hoarse voice, and most importantly, stridor. And stridor is a harsh breathing sound. It sounds like so it sounds breathing in, it sounds super harsh, like it's hard for the child to get the air in.
How do you get croup?
Great question. So when people talk about croup, a lot of times people tell me a croupy cough, and what they're referring to is a barky cough. That's not necessarily croup. So there's a lot of things that can cause a barky cough that are not viral croup. But what we're going to talk about today is viral croup. And the most common cause of that is parainfluenza virus. So not flu. There's no vaccine against this virus, but parainfluenza virus. And there's 4 types that commonly circulate. Type 1 is the most common. We're not seeing that right now in Houston. We're seeing type 4. It's a pretty mild form. So that's good news for our little kids with croup. And babies tend to catch it beginning at 6 months when they start putting their hands in their mouth all the time. They touch surfaces contaminated with the virus and then they self-inoculate. They put it right into their mouth or nose. And adults can get the virus parainfluenza, but they have laryngitis instead of the actual croup illness. It's very mild for them, but they absolutely can pass it on to others through droplets. So covering your cough, mask wearing, and good hand washing. It's not technically airborne like some of our other things that have been going around. But if you're within 3 feet of somebody who's coughing really hard, those particles can land in your mouth and your nose, and you can definitely catch it.
And how long does it last for?
First 3 days are the most touch and go, the first 72 hours. So during that time, the kids start off with a stuffy nose. Usually on the second day, they'll run some fever. And then at nighttime, they'll start to have some of that stridor sound, that difficulty breathing, the and this heavy breathing. You can sometimes see retractions of the skin up here on the neck or retractions of the ribs. And after those first 3 days, if the baby pulls through fine on that, then it's just a bit of a cough that lasts for about a week and a hoarse voice that'll eventually develop. Viral croup is contagious. The other forms of croup-like illness that are not due to the virus, those can be associated with kids with acid reflux, asthma, allergies. The most bizarre one I saw was a baby with a vascular ring, which is like a anomaly of the way the blood vessels were formed around the heart, anatomic airway issues, and they will tend to have recurrent episodes or spasmodic croup.
And croup, you see it between the months of when and when?
It usually starts up around September, October in Houston area, and then we'll see it through about March. Occasionally we see some in the off months, but that's the typical time, fall through early spring.
Wonderful. Well, croup's not wonderful, but
right.
Yeah. Is there anything else that you would like to share about croup?
Yeah. So if your little child starts having a hard time breathing and it's the middle of the day and they're less than 4 years old, I would not assume that's croup. 95% of calls I get about croup happen at nighttime. It's much worse at night for whatever reason. And during daytime, if your little one starts having a hard time breathing, you need to reach out to your doctor right away, because we always have to consider a foreign body, that they pick up that penny off the ground and swallow it or get it in their airway, or some little, speck of something on the carpet that those little tiny fingers can get to. That's really important to remember. Don't assume it's croup. You need to reach out to your doctor if your baby's having a hard time breathing. I want to be sure people also know allergic reactions can cause a croup-like sudden onset. So if you have a child that gets stung by an insect, or maybe you don't even know what happened, but you see facial swelling along with that and they're drooling, you need to consider that as an allergic reaction before anything else. If you have Benadryl, give it right away. If you have an EpiPen, give it right away. If you don't have those things, just call 911 if they have facial swelling, a hard time breathing, drooling. That's an emergency call.
Well, thank you so much. I might call this series 6 Saturdays with Dr. Pate, the expert. Okay. And thank you so much for doing this with us today.
You're welcome. Have a nice day.